Welcome to Ortho Reports Podcast. Today, we're diving into a super strange medical case that really had doctors scratching their heads. It's a true diagnostic detective story where, honestly, the clues just weren't adding up.
Okay, let me throw a puzzle at you. Picture this. Your knees are so unstable that just walking, or forget about it, climbing stairs, is a real struggle. You know, the kind of thing you'd expect after a huge sports injury, except you've never had one. Not a single bad fall, no awkward twist, no big impact, nothing. Well, this exact scenario was the reality for a 24-year-old woman. She walks into a clinic with 2 years of pain in her right knee, and for the last 10 months, her left knee has started acting up too. She's just desperate for an answer to a problem that, for all she knew, just popped up out of thin air. All right, let's really get into her story. I mean, the symptoms were obvious enough, but where they came from, that was a total mystery. For her, just getting through the day had become a massive challenge. So, you can see the list of her problems right there. But here's the real kicker, the part that makes this so strange. She had absolutely zero history of injury. And of course, the doctors did their due diligence. They ruled out all the common stuff, like inflammatory diseases. All the usual suspects? They were nowhere to be found. So, what do you do when the obvious answers aren't there? You start digging. The doctors rolled up their sleeves and began the investigation, starting with a really thorough, hands-on physical exam to try and pinpoint the mechanical source of all this pain and instability. And wow, that physical exam was revealing. The doctors did a bunch of these specific hands-on tests. You've probably heard of them, like the Latchman's test and the pivot shift test. They're basically carefully moving the knee around to see how stable it is. And guess what? For both of her knees, the test lit up like a Christmas tree. Positive results across the board. These are the textbook classic signs of a torn ACL. You know, that main ligament that stops your knee from giving out. And this right here, this is the heart of the mystery. You've got all this physical evidence that's basically screaming, "Hey, chronic ACL tear over here." But then you have the patient story, which completely, totally contradicts it. I mean, it begs the question, how in the world do you tear a ligament you've never even injured? Okay, so to get a look under the hood, they brought in the big guns. Imaging. The MRI scan seemed to seal the deal, showing a deficiency of the ACL in both knees. So now you've got the physical exam and the high-tech scans all pointing in the same direction, but that core question, that how did this happen, was still just hanging in the air. So with all this conflicting evidence, a textbook injury with no actual injury, the surgical team decided there was only one way to get a definitive answer. They needed to go in and see it with their own eyes. They had to look inside the knee joints to finally, hopefully, solve this puzzle.
So they did what's called a diagnostic arthroscopy. It's where they insert a tiny camera into the knee to get a live look. And what they found was just startling. It wasn't that the ACLs were torn or shredded or damaged. No, they just weren't there at all, completely absent.
And that led them to the final and honestly shocking diagnosis: congenital absence of the ACL. See, this was never an injury. It was a condition she was born with. Her body, for whatever reason, had simply never formed these critical ligaments to begin with.
So you're probably wondering, how rare is this? Well, it's incredibly rare. We're talking about a condition that affects about 0.017 per 1,000 live births. Let me put that into perspective for you. That's less than 2 people out of every 100,000. Just wow.
And this, right here, finally explains the biggest question. Why now? Why did she feel fine for over 2 decades? The answer is pretty amazing, actually. Her body had been adapting this whole time. Her surrounding leg muscles basically went into overdrive, working double time to keep her knees stable. They were compensating for the missing ligaments until one day, that compensation just couldn't keep up anymore.
Okay, so mystery solved. But now comes the really big question. How do you fix a problem like this? The surgeons had to come up with a plan, not to repair something that was torn, but to literally build ligaments from the ground up. And the procedure they did was just an incredible piece of bioengineering, really. First, they harvested a tendon from another part of her body to act as the new ligament. Then, using minimally invasive surgery, they drilled these super precise tunnels into her thigh and shin bones, exactly where an ACL is supposed to be. They threaded that new tendon through, locked it down tight, and boom, they effectively built her brand new ACLs from scratch.
And the result? A total success. The surgery gave her immediate mechanical stability in both knees. And what's really amazing is that she was up and starting her rehab the very next day. Just like that, she was on the road to a much more stable and hopefully pain-free life.
So, after all that, what's the big lesson here? What can we learn from this wild medical detective story? Well, it's about more than just this one patient's journey. It's a really important lesson for doctors everywhere.
Really, this case is a huge reminder for any clinician out there. When the symptoms just don't line up with the patient's story, especially when you have a young person with unstable knees but zero history of trauma, you have to start thinking outside the box. You've got to consider these rare possibilities. Having that high index of suspicion is what leads to the right diagnosis and getting them into surgery quickly. And that doesn't just fix the instability. It can actually prevent a lifetime of problems, like really devastating early-onset arthritis.
And that leaves us with one last, pretty fascinating thought to chew on. This whole case is just a powerful testament to how incredible our bodies are at adapting, how they can mask really significant problems for years, sometimes even decades. It really makes you wonder, doesn't it? How many other invisible conditions are out there, just hidden by our body's amazing ability to compensate? Thanks so much for tuning in.